Bleeding time. This test may be ordered as a bleeding time or as an IV bleeding time. A small, superficial wound is nicked in the patient's forearm. Essentially, the amount of time it takes for the wound to stop bleeding is recorded at bedside. The IV bleeding time test is one standardized method. All methods are manual or point of care. A bleeding time is a rough measure of platelet, thrombocyte, function. The test is often performed on a preoperative patient. Blood count, automated differential WBC count. Manual differential WBC count, Buffy coat. Method is automated cell counter or manual. Blood count, Spun Microhematocrit. A Spun Microhematocrit only reports the volume of packed red cells. It is typically performed at sites where limited testing is available, the patient is a very difficult blood draw, or on infants. Blood count, automated differential WBC count. Manual differential WBC count, Buffy coat. Method is automated cell counter or manual. Blood count, Spun Microhematocrit. A Spun Microhematocrit only reports the volume of packed red cells. It is typically performed at sites where limited testing is available, the patient is a very difficult blood draw, or on infants. Blood count, Hematocrit, HCT. The hematocrit or volume of packed red cells, VPRC, in the blood sample is calculated by multiplying the red blood cell count or RBC times the mean corpuscular volume or MCV. Blood count, hemoglobin. Method is usually automated cell counter, but a manual method is seen in labs with a limited test menu and blood bank drawing stations. Blood count, blood smear, microscopic examination, with manual differential WBC count. Without manual differential WBC count. The method is manual testing. A blood smear is prepared and microscopically examined for the presence of normal cell constituents, including white blood cells, red blood cells, and platelets. Blood count, complete, CBC, automated, hemoglobin, HCT, RBC, WBC, and platelet count. An automated differential WBC count. Blood count, manual cell count, erythrocyte, leukocyte, or platelet, each. Blood count, red blood cell, RBC, automated. Blood count, reticulocyte, manual. Automated. A blood smear is prepared and stained with a dye that highlights the reticulum in the immature red blood cells, or the reticulocytes. The reticulocytes reported as a percentage of total red blood cells. Blood count, reticulocytes, automated, including one or more cellular parameters, e.g., reticulocyte hemoglobin content CHR, immature reticulocyte fraction IRF, reticulocyte volume MRV, RNA content, direct measurement. Blood count, leukocyte, WBC, automated. Blood count, platelet, automated. Reticulated platelet assay. The method is flow cytometry. Blood smear, peripheral, interpretation by physician with written report. This test may be ordered as a peripheral blood smear with interpretation by a physician, with a written report. The specimen is whole blood. The method is manual. Bone marrow, smear interpretation. This test may be ordered as a bone marrow smear interpretation with or without differential cell count. The specimen is by aspiration with a syringe. The method is manual. Slides or smears are prepared from the aspirate and stained. The slides are reviewed by a physician/pathologist and a written interpretation of the findings is submitted. Chromogenic substrate assay. The specimen is plasma. The method is usually automated coagulation instrument or manual. Clot retraction. Clot lysis time, whole blood dilution. The specimen is whole blood. The method is manual. The tubes are examined at 24 and 48-hour intervals to assess degeneration of the clots. Clotting, factor 2, prothrombin, specific. This test may be ordered as a factor 2, clotting factor 2, or a prothrombin factor assay. The specimen is plasma. The method is usually automated coagulation instrument or manual. Clotting, factor V, AC or proxylarin, labile factor. This test may be ordered as a factor V, clotting factor V, or labile factor assay. It may be ordered as a proxylarin assay or an AC factor assay. Clotting, factor 7, proconvertin, stable factor. This test may be ordered as a factor 7 assay, stable factor assay, or clotting factor 7 assay. It may also be ordered as a proconvertin assay. The specimen is plasma. The method is usually automated coagulation instrument or manual. Clotting, factor 8, AHG, 1 stage. Clotting, factor 8 related antigen. This test may be ordered as a factor 8 assay, AHF, or an anti-hemophilic globulin or AHG assay. The specimen is plasma. The method is automated coagulation instrument or manual. Clotting, factor 8, VW factor, ristocetin cofactor. Clotting, factor 8, VW factor antigen. This test may be ordered as a ristocetin cofactor, VIIRRCO, or von Willebrand factor ristocetin cofactor. The specimen is plasma. The method is automated coagulation instrument or manual. Clotting, factor 9, PTC or Christmas. Clotting, factor X, Stewart-Prower. Clotting, factor 11, PDA. Clotting, factor 12, Hagemann. This test may be ordered as a factor 12 assay or as a Hagemann factor assay. The specimen is plasma. The method is automated coagulation instrument or manual. Clotting, factor 13, fibrin stabilizing. Screen solubility. Clotting, precolicrane assay, Fletcher factor assay. Clotting, high molecular weight kininogen, HMWK, assay, Fitzgerald factor assay. The specimen is plasma. The method is automated coagulation instrument or manual. Clotting inhibitors or anticoagulants, antithrombin 3, activity. Antithrombin 3, antigen assay. This test may be ordered as an antithrombin 3 assay, the specimen is plasma. The method is automated coagulation instrument or manual. Clotting inhibitors or anticoagulants, protein C, antigen. Protein C, activity. Protein S, total. Protein S, free. This test may be ordered as a protein C assay, or as a functional protein C assay. The specimen is plasma. The method is enzyme immunoassay. Clotting, Factor 8, von Willebrand factor, multimetric analysis. The specimen is plasma. The method is agarose gel electrophoresis. Activated protein C, APC, resistance assay. This test may be requested as activated protein C, APC, resistance test. Specimen is plasma. Method is clotting assay. Factor inhibitor test. This test may be ordered as a factor inhibitor test or a Bethesda qualitative test. The specimen plasma. The method is automated coagulation instrument or manual. Activated protein C, APC, resistance assay. This test may be requested as activated protein C, APC, resistance test. Specimen is plasma. Method is clotting assay. Factor inhibitor test. This test may be ordered as a factor inhibitor test or a Bethesda qualitative test. The specimen plasma. The method is automated coagulation instrument or manual. Coagulation time, Lee and White. This test may be ordered as a clotting time, a whole blood clotting time, or a Lee-White clotting time. Coagulation time, activated. This test may be ordered as an activated clotting time, an activated whole blood clotting time, or an activated Lee-White clotting time. The specimen is whole blood. The method is manual. Coagulation time, other methods. This test may be ordered as a clotting time. The specimen is whole blood finger stick or, in infants, heel stick. Point of care testing often involves a handheld instrument that gives some measurement of whole blood clotting time. Euglobulin lysis. This test may be ordered as euglobulin lysis time, euglobulin clot lysis time, or an EGT. The specimen is plasma. The method is manual. Fibrin, OGen, degradation, split, products, FDP, FSP, agglutination slide, semi-quantitative. Paracoagulation. Quantitative. Specimen is blood or urine. The test method is latex agglutination. In 85366, this test may be ordered as a protamine paracoagulation, fibrin monomer, ethanol gelation or ethanol gel, protamine sulfate, or protamine gelation test. In 85370 the method is radioimmunoassay. Fibrin degradation products, D-dimer, qualitative or semi-quantitative. Quantitative. Ultrasensitive, e.g., for evaluation for venous thromboembolism, qualitative or semi-quantitative. These tests may be ordered as D-dimer, latex agglutination, or slide D-dimer, semi-quantitative or qualitative. The specimen is plasma. Fibrinolysis or coagulopathy screen, interpretation and report. This test may be ordered as a fibrinolysis screen, as a coagulopathy screen, or as a disseminated intravascular coagulopathy, DIC, screen. The specimen is blood. The method combines automated coagulation instrument, latex agglutination, and automated cell counter. Coagulation/fibrinolysis assay, whole blood, e.g., viscoelastic clot assessment, including use of any pharmacologic additive, S, as indicated, including interpretation and written report, per day. A coagulation/fibrinolysis assay is done on whole blood to assess the viscoelastic properties of blood as it clots. Coagulation and fibrinolysis, Functional activity, not otherwise specified, e.g., atoms 13, each analyte. Specimen is plasma and test method is enzyme-linked immunosorbent assay, ELISA, or fluorescence energy transfer, FRET.